Welcome, Dr. Taylor Sewell. We are here to discuss all things about radical chiropractic, and thank you for coming on here to do our spotlight series of the best in Utah of pelvic health. And I'm just going to jump in with reading a little bit about your bio here,
Perfect.
and then we'll go right into all the questions. So, Dr. Taylor is a family man at first and a chiropractor second. He was born in Wyoming and has spent the last few years traveling the country to serve and learn from some of the best chiropractors in the world. He has recently relocated back to Salt Lake area to found Radical Chiropractic Company with his wife, Tabitha, and their 3 children. Dr. Taylor found his passion for chiropractic when he was serving a local chiropractic practice as a licensed massage therapist. He then went on to attend the prestigious Parker University of Chiropractic in Dallas, Texas, where he received his doctorate degree and earned his advanced proficiency certifications as a torque release practitioner. He's a member of the ICPA, and he also received Webster's certification, an advanced certification that instructs doctors on to specifically care for perinatal and postpartum mothers. In his time away from the practice, Dr. Taylor loves to go hiking and hit the gym, but he adamantly spends most of his waking hours supporting his kids in their extracurricular activities. Isn't that true?
Yes, it is true.
Yes. So thank you for being on today. And we're going to jump right into that first question of like, what made you decide to be a chiropractor? Obviously, you were a massage therapist first and then went chiropractic. So walk us through the story.
Yeah. Well, it's kind of a funny story looking back. So I was a massage therapist, and I got a job working for a local chiropractor downtown. Um, my job was to show up and do massages and then leave, right? But the chiropractor wanted me to be a little bit more a part of the practice, right? Wanted me to come in and get adjusted and learn about chiropractic, and I didn't really know anything about it at the time. But I didn't really want to do that. I was like, no, no, thank you. I just want to work and leave, right? And so I didn't show up for the free appointments that he set for me to come in, and was kind of being dodgy. And about 6 weeks or so of that, he calls me into his office and basically said, listen, you're going to be a part of our practice or you're not. And if you're not, then we have to have another conversation. So decide what you want to do, right? And he was actually much nicer about it than that. I'm just condensing it down for the sake of the brevity. But so I was like, oh my gosh, I'm gonna get fired if I don't come in and get free adjusting. I guess I'll learn about it. So I did. I came in, I started learning about it. I got to see the effects of chiropractic as I'd been there over time, and I fell in love with it and decided I wanted to be a chiropractor. And so that was what convinced me to pursue chiropractic.
Amazing, amazing, awesome. And then what do you feel like makes you different in what you do and how you do things?
Well, so there's a couple of things I would point out. So one, I'm a little bit older. I got into chiropractic after I'd already been a massage therapist and floundered around and tried to figure out what I wanted to do with my life. And so I have a little bit more of a mature adult perspective on things than a lot of people do. Um, I think that oftentimes people get lost in the weeds of um, the right way to do things, or this is how it has to be, and they don't take into account the practicalities of life, right? Like I could have a care plan for somebody, and this is what you need to do to get better, but maybe it's a construction worker who has to work 60, 80 hours a week to support his family. He's not going to be able to do the things I tell him to do. He's not going to be able to rest. And so you just have to merge the practical with the realities of the situation with the realities of my recommendations, right? And adjust for that. And some people are just like, nope, these are my recommendations. And if he wants it, he'll do it at the end. Um, and then the other end of the spectrum, you have people that are sort of like checked out. They just don't care anymore. And they're just like, yeah, well, whatever. And so I think that I really hit the middle of the road, right? We really care about our patients. We want to see you get better. And we have room for the realities of life and try to make things work given your unique situation, whatever that is.
Awesome, awesome, so cool. Okay, who would you say would be an ideal fit for someone to come to your practice?
So we really, really love taking care of pregnant women, right, and children. Those are great. We love those. And then we're really seeing there's such a huge population of people that are suffering from disc issues, right? Everybody knows someone that's suffering from a disc issue, right? Whether you're a hardworking laborer, whether you have a more sedentary job and you sit, right? Sitting is the new smoking. It affects all of us terribly, right? Pregnant women, right? How many women do you know that suffer sciatica or a disc issue because of as a complication from pregnancy, right? Or after effects. We just see that so often, and it's really funny how our practice focus has shifted a little bit to dealing with so much of these disc issues because they're so common. And unfortunately, the answers to deal with them are not very good, right? The answers basically are conservative care manage the pain until you can't any longer, and then surgery, right? And there's a lot of steps in that pathway, but that's basically what it is, right? You start with chiropractic or physical therapy. The disc issue doesn't get better. You move on to pain management. That helps for a little while until it doesn't, and then you have to get surgery or you suffer, right? Surgery or suffer. Those are the two options you're left with, which are not very fun options to have. And so we've really focused on trying to actually help solve those issues instead of just sort of put a band-aid on the treatment, right? Come in, get adjusted, have a nice day, come back and see me when it hurts again next week, right? We don't like those answers.
Yeah, awesome. And then what does the process look like to work with you?
So we've really tried to streamline this as much as possible. And the biggest thing we've done is this online forms, right? So you can do all of our forms. No one likes to do paperwork, right? You can do it all online. So you can do it
That's
from
very
home or
nice.
whenever it's convenient so that when you show up, you don't have to, great, you're here. Here's 12 pages of paperwork to fill out, right? Um, I don't like doing it. I don't know anyone that likes doing it. And so that's one of the biggest things, right? Is the paperwork issue. And then after that, it's really simple, right? You just sort of call and let us know, and then when we deal with you, we see people that come in unexpected all the time. We try to be accommodating because life's messy.
Yeah, yeah, awesome. Okay. And then what in the pregnancy postpartum world of like transitioning into that postpartum time frame, what does that look like for recovery for you? What's your clinical ethos around recovery postpartum?
Well, so this is depends a little bit on the pregnant woman in particular, right? So we always want to do a check as soon as possible after giving birth because the pubis can line up incorrectly or the hips can be off or you might have a musculoskeletal issue from depending on if how difficult was the birth or how strenuous, right? Maybe they did some sort of intervention, right? Maybe you had an episiotomy or something and now you're suffering from those type of issues. Excuse me, sorry. And the one of the biggest uh, issues that we see is the sequelae of after giving birth, right? So it's not that like your hips are off and that's like, okay, a centimeter off. Well, that's not a big deal, right? Well, maybe not, but you have a little bit of hip pain and then that carries over and you don't do anything about it for 6 months, a year, 18 months. And now you have knee pain and your feet hurt and your back is hurting all the time because you didn't get it checked and lined up appropriately after birth, right? We see that with women all the time, right? Where and sometimes it's really simple fixes, right? It's like put the body where it needs to be and then get out of the way and let it heal. And so we recommend that you get checked right away. And then we just sort of see, right? Are you getting better or are you getting worse? Or are you changing or not, right? If you're changing for the better, then we really don't have to do anything. Maybe a wellness adjustment and just let your body heal. Maybe you need some more interventions. But we don't know that always right away. So we have to see. And if you wait until, you know, a little problem becomes a big problem, it's a lot harder to fix.
Right,
So
right.
that's what we try and do with recovery is make it as simple and easy as possible.
Love that. Love that. Okay. And then what is something that most people don't know that you think that they should know, either about chiropractic, about yourself, about health and wellness, about birth, like anything? What's your
Well,
nugget?
I think that this is changing a lot, especially after 2020 and COVID and some of the things that are happening now. But chiropractors, we're licensed physicians, right? We go to grad school. We have an equivalent to a medical degree. I did not get a certification at a strip mall, right? I had someone ask me that. Um, we're we're real doctors. We go to real school. We have to have postgraduate education, all that type of stuff. And so we are as equally qualified, if not better qualified in some instances, to diagnose and treat musculoskeletal disorders
Yeah.
than like an MD. And as for an example, it'd be X-rays. So we take a year of studying X-rays in med school. They have like one semester, right? And if you go to we regularly see this, right, where you go to the ER to see if something's wrong, they take an X-ray and say nothing's broken, you're good. Well,
Mhm.
just because something's broken or not broken, rather, doesn't mean that you're good, right? There could be lots of stuff that's wrong that's not broken in between healthy and broken. There's a lot that can happen there. And we regularly see things that people have missed because I look at x-rays on almost every patient that I see. I'm examining x-rays. I'm looking to see if things are lined up appropriately. Are things shifted when they're not supposed to be? It can be not broken and still be injured. And we
Right.
just see that all the time. And people sort of have this idea that, oh, I went to the emergency room or I had an MD that said it was fine, looked at it. They might look at one x-ray a year or a month. We look at, dozens a day sometimes, and it's
Mhm.
so it's all about specificity, right? If you have
Right.
a heart issue, like you need a valve replaced, you want to go to the guy that does heart valves, Yeah, you don't go to your general guy that just, yeah, I'll do surgery on whatever. Nobody wants to go to that guy. You want to go to the guy that does the one valve all day long that you need done.
Yep.
And it's kind of the same idea. If you have a spinal issue or a musculoskeletal issue, you want to go to somebody that deals with those all the time, that's a specialist in those, right? You don't want to go to someone that say, I can do that. Well,
Yep.
do you do it regularly? Do you specialize in it? How many people do you see? Just because you see one a month doesn't might not be the best fit, right?
Same for us, right? Same as pelvic.
Yeah,
We're like, are you really a pelvic PT? Yeah. I don't know about that. Yeah.
exactly.
Awesome. Awesome. Okay. Is there anything special that you want to promote to our audience that's listening here?
So I guess the biggest thing is that we have a $47 special that we're doing for, that includes everything for the full consultation. So when you come in, we can go over what's going on with you. I'll listen to your issues. I'll make some recommendations off what you tell me. We'll do imaging if we need to. So we'll take some x-rays if we think it's appropriate. All of that's included, including the first treatment, right? So we can have an opportunity to come in, get your issues looked at, kind of find out what I think's going on. If I think I can help with it, right? Almost always the case. I just sent a lady out yesterday who came into our office because I didn't think I was going to be able to help her, right? And so that happens. There's issues that I don't think we're going to be able to help you with, and I'll tell you that. Unfortunately, if I think that's the case, you've come to the wrong place, and so you have to worry about getting. Well, if I go there, I have to just go and get adjusted. That's what they're going to tell me. That's sort of fear. Some people say, once I start getting adjusted, I just have to keep getting adjusted. Well, I mean, that might be the recommendation that you have regular care, but that's not something you have to do. It's like brushing your teeth. Just because you start brushing your teeth doesn't mean you have to do it. It might be recommended that you do it regularly, but that doesn't mean that you're like like if I didn't brush my teeth that first time, I would never had cavities. It doesn't work that way.
Right, right. Awesome. And then this is my favorite question to ask. What is the main thing that you want to be known for?
I really think the biggest thing that we would love to be known for is just like how much we love and care for our community, right? We regularly come in after hours. We went in on Friday night to see a patient because they were hurting in a car accident and didn't know what to do, didn't know who to go see. They went to the urgent care, and urgent care sent them home with ibuprofen. They're
Right.
like, well, what am I supposed to do now, right? And we regularly do those kinds of things because we care, and we want to have and forge those relationships with our community and the patients that choose to see us.
That's amazing. Awesome. Where can we find you? Website, social media, all the things like that.
Yeah, so we're on Instagram and our website, radicalchiro.com. You can look us up, Radical Chiro on Instagram, and our social media is all the same, Radical Chiro, and we would love to interact with anybody and come find us.
Amazing. Well, thank you so much for taking some time out of your busy day to chat with us about all things radical chiropractic. And I look forward to seeing you soon.
Thanks so much.